And welcome back. The COVID-19 Doesn't Care is a public health video that's actually showcasing an entertaining, non-judgmental, empathetic, and apolitical myth-busting riff concerning COVID-19. The video includes scientific information about reliable academic sources about COVID-19 transmission and vaccine development. Here to tell us a little bit more is the Provost, the Vice President of Research and Faculty at Kean University, Dr. Jeffrey H. Toney, and also MD at NYU Langone Medical Center, Dr. Stephanie Ishak. And thank you so much for being with us.
It's my pleasure, Daren. Thank you for having us on, and thank you for the interest in our work to promote public health.
Well, thank you. And I'll start with you first, Dr. Jeff. If you just share a little bit with us about the COVID-19 Doesn't Care. As we said, it's a public health initiative, right? Raising awareness in the midst of the fact that we've got our numbers that continue to rise. Your work seems very important at this time.
Well, thank you. Well, Dr. Ishak and I really felt that there have been so many confusing, conflicting messages to the public about COVID-19. You hear, going back to February, wear a mask, don't wear a mask. There's a vaccine coming, vaccines aren't safe, all these different conflicting messages. So we really felt that the best way to connect with the public is to connect with them on an empathetic, understanding level, to not necessarily focus on the scientific information, because we know that it changes every day as we learn more and more about the virus. And I think Dr. Ishak, as my collaborator, as a physician scientist, can bring a different perspective to that as well.
And we know that you work on the front lines, Dr. Ishak. You tell me a little bit about that work, what it's been like for you on the front lines amidst COVID-19.
It's been obviously very stressful. It's been quite an experience, but I think we're doing a lot better compared to how things were back in March. But it continues to be a struggle, obviously. The numbers keep rising. Right now, working on the front lines is a very difficult process for me. But at the end of the day, I'm very happy that I'm able to contribute in such a positive way to saving lives and helping inform people. And so relating my work as a physician scientist to this video and the importance of how we came about the script was really something that was important. So I had many patients that I've obviously seen during this time, and some of the stories that I've witnessed have been, quite I guess I want to say very impactful. And so I want to give an example of an instance of a patient that I had to deal with and how it came about integrating into our script. And so there was a patient that I had who did not want to wear a mask, completely against mask wearing, completely against anything that was being talked about on the news and in the media, and also including what doctors have been saying, wear a mask, social distance, and they just didn't want to comply with this. So after talking to them in a very non-judgmental manner and in a very empathetic way, I was able to relay to them the importance of mask wearing. So I listened to what they had to say. I tried to be empathetic. I tried to be non-judgmental, and speaking to them in this manner allowed them to understand things from a different perspective. So I want to just say that the tone, the attitude, and the way you display concern for patients can change how people think. Is the delivery of the information. It's not what you say, but it's how you say it, right? And so I was able to convince multiple patients to wear masks and to social distance and to follow what the CDC was saying and what other doctors and scientists have been trying to relay. And I think the political divisiveness that we've been dealing with right now have convinced people to think of the virus as a political issue, but it's not a political issue. It's a public health issue. And so me combining my experience on the front line, dealing with sick patients, but also patients who don't want to comply, and then relating it to this video has really been able to allow me to, in a very effective way, perform science communication and try to relay my message, which is, listen to the experts.
Right. And when we talk about this video, obviously, what is the takeaway, Dr. Jeff, for people who watch this video? Obviously, you said it's apolitical. There's a lot of things to it. What do you think is the takeaway?
Well, the main takeaway is to, instead of focusing on ourselves as an individual, to remember that when we're in a pandemic that affects all of society, that we distilled it down into three simple words. Think we, not me. In other words, if you think about your behavior affects the entire community, and we all want to protect our families, we want to protect our neighborhood, we want to protect the community, that if we have that kind of mindset, it's going to help us all in the end. And the other important part of our video is to emphasize the importance of information that comes from a reliable, authoritative source. We get so much information from so many different sources. It's no wonder the public is confused. So it's only a 3-minute video, but in the last minute or so, we focus on the question of, think about where you got the information. Is it timely? Is it accurate? And does it reflect what the experts are saying now? Because as Dr. Ishak said, if the public will, in a sense, remove themselves from the politics, focus on community public health, the fact that we all care for one another, that we have empathy as a broader community, and I'm so glad we have this chance to share that message, that at the end of the day, we will get through all this together. We'll be stronger than ever, even though right now, as a society, we're ripped apart and we have to talk to each other through computers instead of in person.
Yeah. Well, talk to me, Dr. Stephanie, about the fact that you're actually being featured and your work is actually being featured at the Scientific Research Honor Society Art and Film Festival. What's that like for you, getting that kind of response and being out there?
It's been amazing, honestly. The responsiveness that we've gotten from this video has been amazing. Just to give you a little bit of statistics, we have over 10,200 views across all platforms. That includes Instagram, Facebook, YouTube, TikTok. We've reached over 274,000 people on Facebook. So we've received really, really great response, and it's been an awesome opportunity to be a part of this program and being able to really reach people on a high level. So saving lives in the hospital is really important to me, but also being able to effectively communicate in this way reaches my message across to the whole world, essentially, because in our video, there are people from India. It's international. We've included a very diverse group of people, and that was important to me as well. And Dr. Toney, including a diverse group of people to really get across our message and be inclusive and in a very empathetic way, tell people, hey, we need to protect ourselves. And, the other thing that's important to us as well when we were thinking about scripting for Sigma Xi on this video was the fact that a lot of videos that are out there right now are very lecture-based and dry, and they're very like, you must wear a mask, you have to do this, you have to do that. That's not the right way to effectively communicate with patients. And as I mentioned before, if you lend a listening ear and you pay attention to what people are saying and you just empathize and in a non-judgmental way say to them, I understand what you're saying, but how about we look at this in a different angle? It can really change the minds of people. And like I said, we've gotten lots of positive responses and we're really excited about this. And I'm very proud of the work that we've done thus far.
Before we go, give me an opportunity to share with our viewers, if someone wants to see this video and maybe they're not a part of the medical community, how do they go about seeing this video and where can they access it?
Well, all they have to do is search for COVID-19 Doesn't Care and the Scientific Honor Society, and they'll find it on all these different platforms. And I hope that they'll share it with friends and family and so forth to get out the message. Because as Dr. Ishak said, too often the experts in the fields, whether they're a scientist or physician scientists, they tend to not be effective communicators. They tend to turn the public off about talking in scientific and technical terms. We really wanted this to speak to their hearts rather than their minds.
Dr. Jeff, Dr. Stephanie, thank you so much for sharing with us the great work that's going on. And obviously, as we're talking about a potential second wave and we're trying to navigate through this, your work is very important and very timely for a time such as this. Thank you guys so much.
Thank you.
Thank you. I appreciate it.
All righty. And we want our viewers to stay with us because guess what? We do have more open coming up. Stay with us. We'll be right back. in a few.